Hello friends, let's learn heart attack. It's also called myocardial infarction. It occurs when blood flow that brings oxygen to heart muscles is severely reduced or cut off completely. How it happens? Before it, you can see right and left coronary arteries which supplies oxygenated blood to heart muscles. Any blockage is usually due to buildup of fat, cholesterol and other substance called plaques in the coronary artery will lead to lack of blood supply in the heart muscles. The process of plaque buildup is called atherosclerosis. What happened then? Lack of blood supply will lead to damage and destruction of heart muscles. This condition is called heart attack or myocardial infarction. For more understanding, here you can see blood is flowing freely through coronary arteries and the process of atherosclerosis takes place and it blocks the blood flow and destruction of heart muscles. Let's see the causes of heart attack. Coronary artery spasm. It is severe sudden narrowing of coronary arteries. Next is spontaneous coronary artery dissection. Scad. This is caused by tear inside the coronary artery. Then anomalous coronary arteries. It means coronary arteries are in abnormal position while you born. Certain infections like COVID-19 and other viral infection can cause damage to heart muscles. Risk factors, it includes family history of heart attacks, age above 40, tobacco use, high blood pressure, high cholesterol or triglycerides, diabetics, obesity, metabolic syndrome, lack of physical activity, unhealthy diet, stress, illegal drug usage, history of preclampsia, it means high blood pressure during pregnancy, and an autoimmune conditions like rheumatoid arthritis and lupus can increase the risk. What are the signs and symptoms of heart attack? Chest pain, excusing pain mainly in left side, radiating to left arm, shoulder, neck and back, shortness of breath, heart palpitations, heartburn or indigestion, nausea, fatigue, lightheadedness, sudden dizziness, anxiety, insomnia are the signs and symptoms of heart attack. Let's see diagnostic measures. Physical examination. Healthcare provider can check your pulse, blood oxygen levels, blood pressure, heart and lung sounds. Blood test. Check for cardiac troponin. This is a chemical marker appear in bloodstream if there is any damage to heart muscle cells during heart attack. Generally speaking, normal troponin level ranges from 0 to 0.04 nanogram per ml. However, it can vary among laboratories. Troponin levels that higher than 0.04 ng per ml indicate recent myocardial infarction. Additionally, you can do CBC, electrolyte, kidney function test, BNP, D-dimer, PT-INR, APTT and TSH. Then ECG. It helps to identify any rhythm abnormalities like AF or atrial flutter. Most of the people have ST segment elevation in their ECG. It is due to an acute complete blockage of major coronary artery. This condition is called STEMI. ST segment elevation myocardial infarction. If partial blockage in coronary artery, it will lead to non-ST elevation myocardial infarction and STEMI. But remember, in some people with non-STEMI may have complete blockage of coronary artery. Echocardiogram. It tells how heart is squeezing and how well valves are working. Coronary angiogram, cardiac CT, cardiac MRI, exercise stress tests, and nuclear heart scans. It includes SPECT and PET. Next is treatments. The main goal is restoring blood flow to the affected heart muscles as soon as possible. It's ranging from medication to surgery. Supplementary oxygen. If the patient trouble with breathing or low oxygen level can receive oxygen therapy. Medications. It includes anticoagulant medicines like aspirin, nitroglycerin. It relieves chest pain and causes blood vessels to widen. Thrombolytic medications. It can use first 12 hours after heart attack. Pain medication. Most common use in pain medication during heart attack is morphine. Beta blockers. It helps to slow down the heart rate. Antihypertensive. It decreases blood pressure and helps to recover from the injury. Statins. It helps to stabilize the plaque in heart's blood vessels and reduce cholesterol. Antiarrhythmic drugs. Heart attack can cause malfunction in normal heartbeat, can cause any arrhythmias. Let's see the procedure. PCI, percutaneous coronary interventions or coronary angioplasty. It involves balloon angioplasty and angioplasty with the stents. Here, balloon-tipped catheter inserted into coronary artery where the block is located. Rapid inflation and deflation of the balloon push out the blockage and re-establish the blood flow. This is called balloon angioplasty. In addition to balloon treatment, healthcare provider place a stent here permanently. This is called angioplasty with stent. Next procedure is coronary artery bypass graft, CABG. This is a open heart surgery aims to bypass narrowing in heart arteries by using arteries or veins harvested from other parts of the body. Thus, it's restoring adequate blood flow. Complications includes heart arrhythmia, cardiogenic shock, heart failure. Damage to heart muscles will cause heart unable to pump blood to the body. This leads to heart failure. It can be temporary or permanent. Then pericarditis, cardiac arrest, heart valve problems, stroke, depression and anxiety. If this video really helps you, please like, share and subscribe my channel. Thanks for watching.